in governmental-run hospitals, they can provide services to those who don't have insurance, and it is illegal for someone to refuse emergency medical services just because they don't have insurance. The argument is also made that a range of health programs are already available and that many employers offer health insurance. And that argument was made by Joe Messerly again. They defend the systems by claiming that while lower-income individuals can qualify for Medicaid, the older and the unemployed individuals can get the Medicare. So there are, they think, okay, well, if you don't have health insurance, yes, healthcare is expensive, but there are other options. It's also a fear that if, with government control of all of healthcare, that there are going to be caps placed on costs, and that doctors will suffer from this, and they won't be rewarded as well for what they do. As much education as they have to go through, as they have to pay for to get these jobs, they're not going to be rewarded as greatly. At least that's a fear that many people have. Okay, so now that we've talked about some of the bad things and some, the bad feelings that people have about universal health care, let's talk about some of the good things about universal health care, or at least some of the benefits from universal health care and why people think that we should have universal health care. Although some are going to disagree, a lot of people think that it's actually going to save money. So according to the Connecticut Coalition for Universal Healthcare, the United States spends at least 40% more per capita on healthcare than any other industrialized country with universal healthcare. 40% more is paid by us. So the Connecticut Coalition for Universal Healthcare also gives the evidence through federal studies. They say, federal studies by the Congressional Budget Office and the General Accounting Office show that single-payer universal health care would save $100 to $200 billion per year, despite covering all of the uninsured and increasing health care benefits. The obvious point is also made that everyone would receive adequate health care and that the United States would have more than enough resources to provide it. So it's also urged by the Connecticut Coalition for Universal Health Care that there would be no lines under a universal healthcare system in the United States because we have about a 30% oversupply of medical equipment and surgeons, whereas the demand for which would only go up about 15%. So we would have more than enough to cover this, and that shouldn't even be a concern for anybody. And then the next subject is, would the transition be more painful than our current system? Some people think that this transition is just going to be really painful. It's hard, it's, time-taking and difficult. But the question is raised, should people settle because they do not want to put effort into bettering our nation, into bettering our healthcare system? Many people say no to these questions. So according to Robert Thompson, in an article written on the pros and cons of universal healthcare, one major advantage of such a system is that it can literally save lives. People die in our country each day because they cannot afford healthcare, and that includes working Americans. This is a travesty, he says. It's heartbreaking that there are millions of people who are contributing tax dollars to our national economy who are not in turn given their most basic need, maintenance of their health. So support as a universal health care often raises the question, can one really put a price tag on a life? So obviously universal health care saves lives. That's one of the benefits points we're trying to get across here. Money wouldn't go to waste on these private insurance companies. And then also according to Robert Thompson, with universal health care, people are able to seek preventative treatment. So this means that they're going to have tests and checkups, and it's before they feel ill, so that the conditions can be picked up in time to easily treat instead of being so far along in any type of illness, disease, sickness that it's just too late. That happens to so many Americans, that it's just too late when they go because they are so afraid of the costs of healthcare when they don't have insurance. So also, some people insist that Americans health insurance payments are so high and they are rising rapidly. And also, even employer subsidized programs are very expensive. You're still paying money for these programs through your employers. And also, we have situations where patients who have bonded with their doctors get on a health insurance plan who says, okay, well, we don't cover that doctor, or that doctor doesn't cover, or doesn't accept our plan. So then, people are having to move away and find a different doctor when they're already comfortable and they've already bonded with this doctor. So that's another issue that many people have with not having universal health care. Also, according to Jerry Isaacs, in the article, thousands die each year in the U.S. because their lack of health insurance. And this was written in February of 2009. 40 million people, including 10 million children, have no form of health insurance in America. And that number continues to grow at about a pace of 1 million people each year. So the reason I am holding this picture up right here is because on this picture there are about 500,000 people to 1 million people. Now, let me read this again. 40 million people, including 10 million children in America, have no form of health insurance, and this number continues to grow by $1 million per year. And also, when we were reading our other stuff, think about the thousands that die each year because they don't have health insurance. And this is, 40 times this many people do not have health insurance. And that number is raising every year. So now that we've looked at universal health care, who has universal health care, why it's important, because it is very important. It is a debatable subject though. There are pros, there are cons, but hopefully I have informed you all a little bit better about the subject of universal health care. Thank you so much for your time, and I hope that you can now, if ever asked about it, share some things that you've learned and be able to educate other people about the subject as well. Because that's what I'm here for, is, to just provide a little bit more information about it and just make people aware of what's going on in the government and, of this issue that, something needs to be done about our healthcare system. Nobody knows the answer, but this is a plausible option, and this is something that many countries are doing, and this is something that works for many countries, and it's saving lives. It really is. It is saving lives. So thank you so much for your time. I hope that you have enjoyed this presentation. Thank you.